What can I say to my spouse who is in a long-term care facility as to why I cannot visit him because of COVID-19? I can only FaceTime with him. Family has sent him cards, pictures, and we had a Facebook portal sent in to the facility to use as FaceTime. It's been 7 weeks of quarantine. Sometimes I think he understands somewhat, and yet he is declining with depression and acts like he is giving up. Every day I tell him I love him and miss him. In trying to help him explain a little further of the situation of why I cannot visit him, I tell him the virus is very contagious and people cannot go to work. Schools and restaurants are closed. I get no response from him. Most of the time, he will not even look at the camera to see me now. Let me say, though, the first couple of weeks of quarantine, he was talking some. I could get a response and usually a wink or a smile, but not now. It has gone on now for so long, I'm afraid that he will never be back to where he was. Even though he did not catch the virus caught him in a different way. As clinicians in HD and understanding the disease very well, I am asking you, what can I say to help?
First of all, I want to say my heart goes out to families, not only this family, but families that have a loved one in a facility. I know that that presents special challenges. The red flag for me in what you read was that in the beginning, it seemed like he was hanging in, but this person has noticed a decline. I think probably the most important thing right now in this scenario is have his physician, whoever oversees his care, screen him for either increasing depression or new onset depression. Because I think under any circumstance, that's a risk. It's a risk for all of us who are in this, but knowing that incidences of depression is high in folks with Huntington's. So if that person has existing depression, they ought to be rescreened. And is there something they can do to help with medication adjustment or starting medications to help this person cope? This person asking the question also kind of highlighted everything that I would recommend, working with the staff to try to reach that person using FaceTime, saying, I love you, letting that person know they're not abandoned. I'm here for you. I'm here present as much as I can be every day. You guys all know, and having dealt, our community knows, and having dealt with people with Huntington's, you can't always say, okay, this is it, and they understand and comprehend it and everything's okay, right? That's kind of an unreal expectation in many cases. But I think this person is doing an extraordinary job about being present for this person, because that's what we're trying to talk about. You can't physically be present, but it looks like she's emotionally trying to be present. And my hat is off to everything that she's doing. And the only other thing I'd add is contacting that person to see if there's some ongoing depression.
I completely agree, Terry. This is not an easy situation for any of us across the country in terms of coronavirus. It's a serious medical one too. Not only am I at Beth Israel Deaconess Medical Center in the outpatient setting, but I actually go to a chronic care hospital a couple times a month, and there are about 50 patients with advanced Huntington's disease. There are about a third of the hospital that got coronavirus. It really is a very serious safety issue, and I think people in a long-term care setting may not recognize that right now. The only other thing that I would add to Terry's comments are that many times in long-term care settings, patients have a particular nurse or aide or manager or someone that they identify with and really connect with and like on some level, and the family members might want to channel some of that good energy through that person at the long-term care center as more of a hands-on personal touch, since we can't get in there ourselves.
I think just being there, like Terry said, emotionally for your family members is the best you can do. I think, yes, if the person is declining and getting depressed and seems to be declining emotionally, definitely getting them an assessment by their provider is a good thing to do.
I just want to say it is not your fault. Do not feel guilt, because it's not your fault that the pandemic happened. It is not your fault you can't visit your loved one. So please do not beat yourself up as a caregiver, because that's what we do as caregivers.
You are doing what's best for him. You are showing him love by not being there, by not showing up. Even though they probably wouldn't let you in, you're still protecting him by not coming. I think that you're doing what's showing the most amount of love, in my opinion.